Yeah, that's a great question. For me, to pursue my MPH or to pursue my master's in general, really, I think it was twofold. So the first was more of a personal ambition for myself. I always wanted to, I don't want to say like test myself in a way, but I always gravitated to wanting to pursue further education. So it was a personal interest of mine to say, how can I more define my scope? And that's where I found, the natural gravitation towards pursuing a master's. So that was something where I said, okay, something I definitely want to do, whether it's right out of school or if I want to take a few years and work first, get back to it after, something I always wanted to attain. And the second reason was it was more of, I guess you could say, vocational. So, here in Ontario and more over in Canada, public health is a very unique degree in the sense where they look specifically for certain types of levels of experience and education. So when you look here to be perhaps like a health promotion specialist, or if you even want to get into epidemiology and research, a lot of these a lot of these roles ask and require people to have this education level as a prerequisite or even as like a qualification. So that was another reason why I decided to pursue my master's in public health. Why I chose my master's in public health compared to other programs was that it was my unique area of interest where I did want to specialize into, but also, with a master's in public health, which, some people may not think.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Welcome to episode 133. Thank you so much for joining me today. If this is your first time tuning in, be sure to hit that subscribe button so you stay up to date with this latest content. If you get value from this episode or the show, please support by leaving a 5-star review to help with the algorithm. And also share this with a friend who would get some value from it. Greatly appreciate that. Today's guest truly shares actionable insights from many parts of your public health journey. I love how she highlights first identifying your values before choosing what you want to do, and first finding alignment in the jobs that you're looking for. She brings up some great insights into job matching and mapping, which played a role in her switching from public health into environmental tech. So definitely listen to this. And she shares great insights for students and early career professionals. So if that sounds like you, enjoy. Today, we have an allied healthcare professional who has a passion for customer success and client management. She went from a focus on public health to environmental tech. She got her bachelor's degree in public health at Brock University, then went on to get her master of public health at Brock University. She currently works in the customer success and client management space. We have Rio Alegre, MPH. Welcome to the show.
Yeah, hi, nice to meet you.
Yeah, pleasure to meet you. I'm so happy that we can connect today, and just tell us how you're doing and how you've been coping during these times.
Yeah, well, I've been doing good, staying safe in good spirits. It's funny, well, funny, not funny, but here in Toronto, it's definitely starting to feel like winter. I'm looking out of my window right now, and it's really cold. So I think at this moment it's about -2 Celsius, so -2 degrees, which is probably around, I don't know, 20s in Fahrenheit. So it is
Correct.
cold. It's really cold. Can't complain because I am indoors and I am safe and, I'm in good spirits and, it is the weekend. So, yes, everything is great.
Yeah. That's good. My sister's supposed to be coming down to North Carolina, where she lives in Toronto as well. So I hear a lot of her strife with the coldness. So I completely understand that.
Yeah, I mean, here in Ontario, we're lucky that, we have had snow, but in other provinces, snow was started, geez, as early as like end of August and even in September. So it's not too bad here, but we do get a nasty wind chill. So it does get fairly cold.
Yeah. I completely understand. Well, I hope that you're able to stay warm.
Definitely. Yeah.
Awesome. So tell us, how do you identify, and tell us a little bit about your personal background?
Yeah, so my name is Rio Alegre. I'm an Asian Canadian who identifies as a cisgender female. So my pronouns are she, her, hers. And I'm firstborn child to two immigrant parents from the Philippines. And I graduated from Brock University here in Ontario, where I received my bachelor's and my master's degree in public health. So I've had a very direct path, I guess you could say, in that field. I've worked in the field for over a decade in many roles and have recently transitioned into the environmental tech space. So, as an onboarding manager in my current role, I work with mid-market size and Fortune 500 companies to become more sustainable. But, in addition to that, in my 9 to 5 role, I work to support recent graduates and early career professionals in navigating, their life post-graduation and their early careers into applied health and beyond. So, yeah, it's a little bit about myself.
Okay, awesome. Well, I look forward to like diving deeper into that, and especially like your process of going into public health, getting your master's of public health, and going into like this environmental tech space, working around like sustainability, which I think is cool. It's not something that we hear enough about. So like I'm looking forward to hear more about that.
Absolutely.
As well as like the help that you do for recent grads and people getting into their early careers, which I think is also important, and a lot of what we do here. So I think the insights on that are going to be helpful once again. Hey y'all, you may be looking for ways to show support for public health, health equity, and this platform, the Public Health Millennial. Well, head over to my shop at thephmillennial.com/shop to buy and support if this show has helped you. Also, use the code podcast for 20% off your next order. Link is in the description to the shop. Be sure to tag me on Instagram at thephmillennial. Thank you. I look forward to sharing your pick. Now back to the show.
Absolutely. Yeah.
So before we get more into like your collegiate journey, what does public health mean to you?
Yeah. When I was a little girl, my father actually passed away from lung cancer. And the most ironic part was that he never smoked a day in his life. And the cause was actually due to a large amount of asbestos within his workplace and long-term exposure. So, actually earlier this week, we commemorated his 22nd death anniversary. And I spent a lot of time thinking about core and happy memories of, the time that we had together. But looking back at that time when I was younger, I didn't really understand what his death meant. And I mean, as a young child, we may not understand the definition of death, but you can definitely feel that something isn't the same. So as I grew up, I told myself, in honor of my dad, I would do something that, would protect people from never having to experience adversity like that again. And that's where I found ground in public health practice. So I used my experience in public health really as what we call that medium. I told myself I wouldn't just want to save one person, but hundreds and thousands of people at a time. So I turned my childhood trauma into what psychologists call into post-traumatic growth. So personally speaking, to me, public health is really enabling communities and underserved populations to be empowered to make health decisions. But, at its most basic, raw, and fundamental level, public health means, just really being a good human. And, at the end of the day, we all want the same things. We want good health and a happy life. And public health, really, it's at the core of our daily life. It's the intersection between art and science, humanities and spirituality. And individuals who work in public health are really those unsung superheroes behind the scenes who dedicate their lives to making our world safer, more accessible, and, leveling the playing field for these marginalized populations and communities. And I only have the utmost respect for these individuals. So, that's kind of my public health story and how I came into working in the field and, what it really means to me.
Yeah, well, thank you. We love that a lot. Sorry for the passing of your dad, but I am happy that it like helped you and like made you think about the world and like how can I honor my dad and do work that is positive to not only my family, what happened here, but to help other communities. And yes, public health is that for many people, and I love to hear it. I also like the term that you use, post-traumatic growth, and I feel like that probably resonates with a lot of people in public health, having some sort of familial issue or something happened to them and really drive them as a force to want to do more public health or like just helping work to bring about better population health. So I appreciate that. And so you got your bachelor's in public health at Brock. And I wanted to ask, like you said, like your journey was straight up in public health, but like when did you know about public health? Was that something that you learned during high school to know to get your bachelor's in public health, or what was that thought process like?
Yeah, that's a great question. Public health to me, it was really a foreign idea, and I didn't really conceptualize that it could be a formal area of study or even a field to work in. So, kind of talking a little bit about like my bachelor or my master's experience and how I got into public health. From the time I was in high school, I was just so fascinated with what we called our health and fitness class, and not so much like the physical education portion, but really like the health study side of things. And I was really interested to learn more about topics like mental health, sexual health, and substance abuse. So naturally, I gravitated to pursue a career as wanting to be like a phys ed teacher. That was kind of like my first, like, okay, this is what I want to do when I graduate and finish schooling, and my first real job or my career path, I thought at the time. But of course, there was a huge deterrent. So at the time, the political and job landscape of getting a full time position as a phys ed teacher or a teacher in general was really next to existent. So there was what we called a teaching freeze in Ontario. So naturally, like the realist in me just said, okay, Rio, we got to scrap the idea. What's plan B? So kind of fast forwarding to my university and college applications, I found out there was an actual area of study called public health, and which to my amazement had, focus on the health studies portion of things, as well as, that fitness portion of the curriculum I loved in high school. So fast forwarding to when I got into university, Brock University was the institution that I chose to accept an offer from. So Brock University has the oldest Bachelor of Public Health program here in Canada. And throughout my undergrad, I took courses which really helped to support that fundamental aspect of public health practice. I took courses like biostatistics, program planning and evaluation, public policy, health promotion, and epidemiology. So really all the core facets of public health and study. And I graduated from my bachelor's in 2015, but then, right after that, I'd accepted an offer back again to Brock University, but this time for my master's of public health. And I entered as the inaugural cohort for this program. So, kind of having a few bars on the MPH, I chose to pursue this MPH for a few reasons. The first reason was the appeal of a fully online remote master's, which definitely allowed for self-autonomy and independent reporting. So this was a huge plus for myself because at the time I was working full-time hours, and this program didn't really require me to sign in for specific times that interfered with my 9 to 5 role. So the second reason why I chose this, and I felt like I didn't really need to pursue a research-based MPH. I was fortunate enough to take what we called a directed readings course in my undergrad, which is basically like an intense research independent study course with a supervisor professor. I was fortunate enough to get published, and at the time, I didn't think it was really necessary for me to pursue professionally, a research-based master's. So those are kind of the few reasons, like, in addition to having a co-op, which was a huge draw, of course, for someone that's still within their studies, and having to have that meaningful work experience embedded into your daily work. So I would say that's kind of my career path. But yeah, I didn't know what public health was when I was a little girl. I knew that I always wanted to kind of honor my father somehow, and taking that trauma that I had and turning it into something where I said I would never want anyone to go through this again. And I don't think for me being a nurse or a doctor or something clinical in the sense where I was just saving one person's life would be meaningful enough to me, not to diminish that role by any means, but I wanted to give back to populations and prevent this at like the large mass scale. So I think naturally I found public health as I learned more about it, through school, education, my personal experiences. But yeah, when I got into school, it became more of a clear delineated path, I would say. So yeah.
Okay, well, thank you for sharing that. There were a lot of great points and insights there that I think people can take away, like really being intentional about the Masters of Public Health that you're doing, and like how does that fit into what you want your life to look like online, looking for the no research base, because that like that's probably not the part of the work that you're doing. Also the co-op, which I think is awesome. I don't think enough schools do co-ops, but it is a huge factor, and I think very, very beneficial for people that are coming out of university to have co-ops, because they bake in these professional development work experiences that you get, which are like amazing. I see. So yeah, if you wanted to add, please feel free.
Yeah, I agree completely. I mean, I don't know what it's like in the US or in the States, but here in Canada, you definitely have programs that do have a co-op option. But again, right, sometimes it's difficult to get a co-op or get entered into a co-op, type program. But in addition to that, right, I know there's volunteer experience and, opportunities like workplace experiences within campus and maybe off campus, but it is still difficult to obviously obtain that. Focusing in a program and then having to navigate and challenge yourself to say, okay, how can I juggle not just like my schooling, but also have a job? But co-ops definitely do make that easier in the sense where you have that embedded path already forward. But again, I can't agree more. I think that more university and colleges need to have that embedded into, opportunities for students. But yeah.
Yeah, absolutely. I have a friend who went to school in Boston and he was in a co-op program. Like he finished in 5 years, but within that 5 years, he got like such helpful experience that has propelled his career in a lot of ways. So yeah, if and there are programs in the US, yeah, I don't know how many, but definitely advocate for that. Yeah, and your first job, I'm guessing, in public health while you're in your bachelor's program was as a community awareness educator at Niagara Region. And I think you also like got promoted or shifted into young adult peer leader there. So would you like to talk about those two experiences?
Yeah, for sure. So, when I was still in school, I was fortunate enough to have certain roles. I wasn't in a co-op program per se, but I felt like I almost kind of built my own program, my own co-op program. I had landed roles within local health departments or local public health units here in Canada and Ontario. So the first role that I ever had was as a community awareness educator at Niagara Region Public Health. And this was like our local health unit / health department around the university. And at the time, we have something called the Smoke Free Ontario Act here. And what it was is we wanted to include, the environment. So beyond, smoking in certain areas, as part of this role that I was working in, I was meant to support the education piece of that. So, working with our tobacco control officers and cessation nurses to create health education packages and, do community events to basically advertise this around the region that I was working in. So that was the first role I found myself in. And this is more of like a summer internship kind of role. And then after that, they had continued to call me back in other roles. And this capacity was a young adult peer leader. So this is working with, different, colleges, university students, as well as, high schools and elementary school students to get them attain to what public health really is and, helping them support their learning in terms of different health programs and initiatives in relation to their age group. So that's a role that I carried with me for quite some time in university. And then, beyond that, I found myself working another summer role as a cultural assistant back at the university. And this was a really interesting role because I was working really closely with international students. So we had students from various continents across the globe, and they would come to the university to learn English as a second language. And what was really interesting about this was I played a really health focused piece to this role, integrating healthy behaviors into their learning. And this was a very intensive learning course and class that they were enrolled in. So, how they could basically reflect on healthy behaviors while still being a student was something that, I was tasked with in this role. So it was fairly interesting. And that kind of took me into my later years of university. And then, as I kind of moved into my third and fourth final year, that's when I found roles within other, health units and health departments. So tobacco being that common thread and, my most natural interested public health topic, because of my father and, everything that had happened in my childhood, I naturally gravitated towards tobacco cessation work. And that's where I found myself as a tobacco-free living student at York. And this was at a health unit, just about an hour and a half away from my university at the time. So again, focusing on different, tobacco cessation health education pieces. And then at the same time, I was also working at the university as, kind of like that health promotion specialist behind the scenes. So, all in all, those were the roles that I had throughout my education, whether that was my bachelor's, my master's, but yeah, pretty straight path in public health. I mean, focusing on a lot of health education and health promotion pieces, but also doing a little bit of public policy. So I've kind of ventured into various, dimensions of public health, but all in all, I think it started right off the bat when I was in school for sure.
Yeah, and I like the point of view saying like even though your program wasn't a co-op, you made
Yeah.
sure to like create your own co-op, which I think is something that everyone should really think about, like to have those experiences as you're coming out, and especially in public health, there's just so much that you can do. Really getting those experiences to know what you like or what you don't like is very invaluable to making your journey just a little bit easier, I would say. Um, and so you got your MPH at Brock, and you said you were working full time. So what job were you working full time at that time, and what was that thought process for you to continue on to get your MPH?
Yeah, so I was working full time as a health promotion specialist, or um, I was working as, oh, sorry, where was it over here? A health promotion specialist team lead at Brock University. So I was doing that, full time hours. But then in addition to that, I was also working my first entry level position, which was a research analyst intern at Niagara Region Public Health. So, coupled with both of those two things, I think that was the first role that kind of, before I graduated, landed in, a full time role in that capacity within the field. Again, very different in terms of the role and scope. So as a health promotion specialist team lead at Brock University, this was really health education, health promotion, and community health at its core. So working for student populations to support, various topics within health promotion. So whether that be sexual health, mental health, physical health, and overall social well-being. I did a lot of, health campaigns within that role. But then on the flip side, as a research analyst intern, this role was really interesting because for me, my specialization in public health has always been health education and health promotion. And this role really landed more towards epidemiology and data research. So I've never deemed myself as really being a numbers kind of gal. So having to, work as a research analyst intern really opened my eyes towards, epidemiology and, going beyond what I've learned in a textbook in a real life setting. So that was really interesting because I was focusing on a lot of health data and doing a lot of surveys in terms of different health programming. So seeing the effects of, data collection and analyzing that to support, statistics for health campaigns really did couple with the experience that I was seeing at like the health promotion side of things as a team lead at Brock. So very two different sides of the spectrum in terms of, specializations in public health, but really opened my eyes towards seeing a holistic approach of how the qualitative side and the quantitative side helps to build robust health programs. So very different.
Yeah, and that's amazing, and I think everyone should be trying to do that, because I think the more that you get varied experiences on maybe like wide spectrums, it helps you to really realize the intersections or like from those spectrums and take across different ways of thinking, which are important. I feel like in solving, as you said, like
Yeah.
public health problems that are not like one way or like needs one discipline, but they need a lot of different thought processes and to ensure that there's like a successful program.
Definitely. Yeah.
Awesome. So why did you want to get an MPH? Was it to like increase your skill level or just feel more certified in the field? What was that decision like?
Yeah, that's a great question. For me, to pursue my MPH or to pursue my master's in general, really, I think it was twofold. So the first was more of a personal ambition for myself. I always wanted to, I don't want to say like test myself in a way, but I always gravitated to wanting to pursue further education. So it was a personal interest of mine to say, how can I more define my scope? And that's where I found, the natural gravitation towards pursuing a master's. So that was something where I said, okay, something I definitely want to do, whether it's right out of school or if I want to take a few years and work first, get back to it after, something I always wanted to attain. And the second reason was it was more of, I guess you could say, vocational. So, here in Ontario and more over in Canada, public health is a very unique degree in the sense where, they look specifically for certain types of, levels of experience and education. So when you look here to be perhaps like a health promotion specialist, or if you even want to get into epidemiology and research, a lot of these program or not programs, a lot of these roles ask and require people to have, this education level as a prerequisite or even as like a qualification. So that was another reason why I decided to pursue my master's in public health. Why I chose my master's in public health compared to other programs was that it was my unique area of interest where I did want to specialize into, but also, with a master's in public health, which, some people may not think, is it allows you to diversify yourself into many different fields. So, looking at your master's in public health and public health as a whole, it's really a mix of various different areas of study. So like I said, arts, science, humanities, you have really that intersection between so many different areas of studies that you can just take that within public health and you can take it into many different career paths. So that's part of the reason why I said, okay, I could gravitate towards just a general master's of science, but I also wanted to kind of specialize. And I felt that with being in public health, you could really go many ways and you could spread yourself in many different areas as well.
Yeah, I love that a lot. And I think that is not very uncommon, especially for people that want to,
Yeah.
like, it's very easy to look up jobs and see that they require an MPH and say, okay, like this is something that has to be a part of my path to like be qualified or be a strong candidate to get this job. So yeah, I completely understand that and the thought process, as well as I like how you said earlier, your thought process in choosing university, like catering to your needs and what you needed and how you thought it would best work into your life going forward, which is awesome.
Yeah. And, like I look at people that are in that situation where they're trying to identify, what kind of master's do I take, or do I even choose to go into school right off the bat, right? I think one of the most difficult decisions is determining, what you like and what you don't like. And sometimes, the silver lining to understanding what you don't like is that, that opens an opportunity for other doors. So if you think about it with a master's of public health and just choosing a graduate degree in general, it is a very difficult decision for many reasons. The first is, it's a commitment. So you're going back to further your education. That's another X amount of dedicated time and years that you might be pursuing to obtain this. And then the second is financial constraints, right? So that is another big piece. And in addition to what you have already accrued, perhaps, with your undergraduate or your bachelor's degree, that might be an additional lump sum of money for folks to pay out of their pocket. So, taking time, even if, that means like taking a few months or a year to make that decision and come back to it, there's nothing wrong with that. A lot of people feel pressured right off the bat to say, okay, like I need to automatically go into a graduate studies program, or I need to pursue school further, or I need to do X, Y, and Z. But, I think the biggest thing, like looking back in my years, is if I had taken more time to think about, what I really wanted to do and taking more judicious steps to make that decision, I don't think I would have felt as pressured or as rushed to kind of jump towards doing an MPH, whether that was doing it, right when I graduated school or had waited a little bit of, time between, when I graduated to like working. So yeah, I think it's really important for folks to take that time to, really do that self-reflection and say, this is a good decision for me. And, I don't want to rush into it. So yeah.
Absolutely agree with that. It's a huge investment both on the financial and on the time side. So yeah, there's no need to rush. And I think like even going deeper into that, it is if you take the time to work and get experience when you do your MPH, I feel like you're able to apply it or just know nuances of the work better than someone who's just coming out from their bachelor's degree. So definitely understand that as well. So you also had a job as a healthy aging and falls prevention student at the regional municipality of York. So tell me about that experience.
Yeah, so that experience was part of my co-op. So that was my co-op when I was in my master's of public health. And what was interesting with that role is that it had to do with healthy aging and fall prevention. So, myself and my supervisor at the time, we were creating this fall prevention strategy for the region that, I was working for. And this role in particular had dealt with a lot of partnership building, policy development, advocacy, and, awareness. So again, kind of going back to what I had learned in my master's as well as my undergrad, I really felt like in this role and all the roles I should say that I've worked in allowed me to really apply theory to practice in terms of what I was studying in school and then applying it into the real world. So, sometimes when you're working with different groups and you're working with different partners across the table, I like to say it feels like you're herding cats because it's really tricky, to have everyone speak their opinions and have agreements in terms of like next steps and goals and objectives and, these KPIs that we want to attain. So in this role, it was really unique because we were just starting to lay that groundwork foundation as to where we wanted to take this strategy and how we wanted to communicate that across all different levels of agencies as well as, community partners. So it was a real true test towards partnership development for sure. But yeah, it was a really interesting role. Again, that was something that I had done in my master's as my co-op. I worked there for the summer months. And then, right after that, I got back into working full time. So it definitely did leverage and support, that growth. And, for myself, I just think it's good experience to work across different, organizations and different types of fields and different areas and concentrations too, because, in public health, there's so many transferable skill sets that you can bring, depending on what program or specialization or area that you find yourself in. But it's also a really good idea to, build your portfolio in that sense. So, healthy aging and fall prevention was something that was very new to me at the time. I had only really learned about it in school, but, to apply that theory to practice, like I had mentioned, really opened my eyes in terms of, seeing what a role could actually look like if I wanted to pursue that post-graduation.
Yeah, absolutely. And that makes a lot of sense, once again. But thank you for sharing that. And was that next full-time role the research assistant at the Epidemiology and Evaluation Services of Public Health Ontario? And was that also during your MPH or was that afterwards?
So this job was actually the first job that I got right after school. So I guess you could say like my first big girl job as soon as I graduated from my MPH.
Before you tell us about the job, what was that process for you, like going through your MPH, looking for this job and applying for it?
Yeah, this one was interesting to say the least. The role that I previously had spoken about, so as a research analyst intern at Niagara Region Public Health, I was doing a little bit of survey work, and in this role, I had worked to support a local program manager under this health initiative called the Healthy Kids Community Challenge. And the Healthy Kids Community Challenge was a province-wide initiative that was led by the Ministry of Health. So similar to like a statewide department in the US. And what it basically was a health promotion campaign that would focus on different areas of childhood health. So obesity, physical activity, different things of that sort. And at the local level, I worked with this local program manager to implement and do all the data behind the scenes. So unfortunately, what had happened was that round of funding had actually, the pot had run dry. So my manager at the time had said, Rio, I would love to keep you here, but I also want to see you spread your wings and, try other things within the field. And this position at, Public Health Ontario, which is kind of similar to the CDC, I guess you could say, as a government agency, I had opened a role as a research assistant within the Epidemiology and Evaluation Services Department. And sure enough, I was actually doing the data behind the scenes for the same program that I was working for at the local level. So that's where the connection was made. And, I said to myself, okay, I guess I should spread my wings and I guess I should try something new. So I had applied to the role. And then sure enough, I had gotten the position. In the role, it was more data intense. So as a research assistant, I was doing a lot of, data uptakes, data cleaning, helping with survey development, things of that sort, and, creating the actual finalized reports. So I could really see it from the back end, which was great. So it was almost like a full circle moment for me, coming from the local level, seeing how that was implemented and rolled out and then scaled up towards, the communities that we were supporting, but then, kind of taking it up at the backside, saying, how does everything get rolled out? So, you really got to support the knowledge translation pieces of, the actual campaign and disseminate that across the province in terms of, what the research and findings were from every local community that participated within this, program. So it was very interesting. I think it was a blessing and a curse at the same time because I realized, okay, still not a numbers person as much as I was great experience and, learning so much about that knowledge translation process in terms of disseminating that out and, the communication that goes on the back end. I really gained more appreciation for epidemiologists and, evaluation as a whole for sure. But, it still to me, it allowed me to really reflect to say, okay, like, what do I like and what do I not like in this role? And the biggest thing was that it just wasn't my interest really. So my interest was going back into local public health and, working with communities and supporting that development. And that's kind of where it took me towards, another health department, which was the city of Hamilton. So something that really resonated with me, and I tell this to this professor, quite often when we catch up, is that I remember graduating from my master's and, taking this role. And I had, met with my previous supervisor and had said, I don't know if I really like this. And I kind of feel stuck, and I don't know if I should be feeling stuck this early in the game. I don't know what to do. And something that he said to me was, Rio, your day will come where you can pick and choose whatever rules will come your way. But, you need to be a sponge and you need to just take the experience as it is. So I said to myself, okay, I'll take the learnings that I have from this role, but then also apply to other roles that I find interesting in. And, I remember the day I had applied to various health departments and health units and didn't think I would get any offers or anything come my way. But I remember applying for 5 specific health units and every one of them gave me an offer letter after this. And, I just remember the tears rolling down my face. It was, happy tears of saying, like, I don't think I've made it yet, but I think I'm making progress. And it really reminded me of that conversation I had with my supervisor. So that's where, the city of Hamilton came in and I accepted a role as a health promotion specialist. And again, full circle moment because I was now leading as a local program manager for the actual Healthy Community Kids Challenge work that I was doing at the province, but, just for another community. So it was really interesting. That role led into many other roles. And then, of course, the pandemic had hit. And, no one had expected back in March 2020, this is exactly where we would find ourselves. And, it's really changed a lot of inner workings in terms of like our healthcare system, public health being one of those, and the way that we even interact to the way that we do business. So things have incrementally changed throughout the pandemic, and that's where I found my last role working at that health department. So I was a team lead and I was supervising what we call the hotline operations program. And this was a public facing, client facing role where, I led a team of 9, 10 applied health working professionals. And what we would do is we would basically answer any Q&As coming down the line or over email from the general public regarding COVID-19. And in this role in particular, you really got to see the good, the bad, and the ugly. You had moments where you really felt like you were living vicariously through the people you were talking with on the phone. And there had been moments of confusion and anger and in moments of, success and hurrah that we've actually figured out what this is. So within that role, in particular, one of the biggest things that I had to take amongst myself and my team too was we were really the voice of reason for the public. Whether that would be, someone that was having a bad mental health day in terms of, needing to seek support and services or just wanting to have someone to talk to, or perhaps urgently seeking care in terms of, what to do with my prognosis and what happens if I now contracted COVID-19 and what do I do? So we were really the advocates behind the scenes to champion that to our management teams, to say, this is what we're hearing on the ground and this is what I think we can do to kind of shift that. So it was really, really interesting. And I think the reason why I decided to, leave that role was because, part of the reason was, I was kind of fed up. If I'm going to be honest, I was a little fed up in the sense where the direction that we were getting from, upper level government. So from the federal level, from the national level, from the provincial level and the state level, I felt like was very ambiguous and not always clear. So, I wanted to continue to champion and advocate for our local health champions to say, how can we close the gap in terms of having seamless communication, more rapid lines of communication, and making it more clear for folks to understand how to support, our community members that are asking for help. So, I took it amongst myself, and there was an opening as a senior program consultant. Again, I didn't think that I was going to land anywhere. I was successful to get the role, and I said, okay, Rio, either I'm shooting myself in the foot because I'm going into the belly of the beast, but, I'm going to champion for, our local health units and departments. So that is exactly what I did in this role. As a consultant, I would work with our public health units to have more of a health equity focus on how they were procuring their vaccines across, the province in terms of COVID-19. Interesting enough, within that role, I also worked with various other ministries. So that's kind of where my role lended itself as the strategic partnerships and business development team lead. So it was a promotion that I got working with another ministry because we were working cross collaboratively. And they said, Rio, I'd like you to lead this strategy, but just for a ministry full time. So I said, sure, I'll take on the role. And that's where I led, our rollout for vaccine procurement for all of our, health units across the province. And that's what kind of made me wanted to continue championing on and just saying, okay, we can be the voice of effort, and there are ways that a top-down approach can be seamless in terms of supporting all the communities across the province. So that's where I decided I want to stick there and I want to take this role. But sure enough, within that role, I had a moment of like self-reflection in terms of everything that had happened up to date because of the pandemic, and not sure where things were going to go. And again, at the time, my unit was in a precarious state where we were a temporary formed division. So we didn't really know where we were going to go. And of course, the realist in me thought, okay, what's next in my life? So, it took a long time for me to do some self-reflection, but what I found was that I really liked working with, people. I really liked working with clients. I liked working with communities, and I really liked that, client community focused role. So I thought to myself, okay, is it really going to hurt me in the long run if I try to find a job outside of public health? And the hardest part of this process was really identifying my values and saying, okay, what are things that I like? What are things that I don't like? And, that's where I thought, okay, maybe I should apply outside of this scope. And that's where I found myself in my current role as a customer onboarding manager. So within this role, it definitely married my interest of, coupling public sector experience with private sector experience and really honing down on those client relationships to say, if we work together, we can really make magic happen here, and we can tackle some of the most difficult and challenging topics within our society and our world today if we work cross collaboratively. So that's where I decided to kind of, venture off. In addition to thinking about my personal interests of tobacco and the environment, I found myself at this company called EcoVadis. And, EcoVadis is a software as a service environmental tech company that specializes in business sustainability ratings. Now, in this role, instead of working with communities and underserved populations, I work with a range of companies from small to medium-sized to Fortune 500 enterprises to become more sustainable and reach their environmental and social development goals. So, these goals have key pillars of sustainability, which, talk about union, labor rights, and sustainable procurement. So I kind of act as that quote unquote program manager, or I could say project manager, that tackles these goals with these companies to reach, their goals of wanting to be more green. So, in that, it was a transformation of, going from entry level to, working my way up to management, and then even transferring over to a new field. It was very ambiguous, I guess you could say, because I didn't know what was going to happen. But it took a lot of self-reflection. But looking back now, I can definitely say that there's a thread of commonality between all these roles. And I was able to kind of take my interests from my previous roles and what I wanted to continue growing in and find a bridge between public health and that of a new sector. So yeah, that's kind of how I found myself in this new space and in this new role.
Okay, awesome, awesome. And I want to ask you more about like that switch from public health into this like more environmental industry, but just want to hit on some things that I think are really important in your transitioning, going through those different roles. Like, first of all, shout out to all the supportive supervisors and bosses and
Oh,
people that say like
absolutely.
let your wings fly, and because many of times people try to keep us, and not necessarily for bad reasons, but it is, in hindsight, it is detrimental to our progress as an individual, as a professional, etc. So I think like just having those kind of people that know that you are capable of more and push you to continue to more, great people to have around you. I love the thread of, as you said, like finding the interest in these different roles and growing from there, being a sponge and taking the experiences and applying them, which are very, very important. And I think it's like awesome to just hear the progression of these roles and just hear that you were able to take on these different roles through the skill sets that you were growing while you're just learning more about what you want. And then, as you said, you switched over into this customer onboarding manager at this at EcoVadis, which is as you said,
Fast company. Yeah.
yeah,
Yeah.
yeah. So a SaaS company doing like business sustainability solutions, which is really cool. And I know like SCGs are big, I think bigger in the Canada than they are in the US, fortunately, unfortunately. But tell me more about like how did you go about thinking switching from like public health to environmental tech? How did you go about searching for the job? How did you know this job was something that would like keep with your values of wanting to do this work, like just switching from the population to helping clients be more sustainable? So tell me more about that thought process.
Yeah, that's a great question. And I think for me, it was really the first step was identifying what are my values. And I know for myself, I'm a very value driven individual with my beliefs and, where I see that work going. I think some of my best work is done when it aligns with something that I really believe in. And, part of the reason is why I gravitated towards public health because I really believe in the core values of, the inner workings of what we could do to help communities and to help people be empowered in terms of making positive health decisions at the end of the day. And same, I found that with this company EcoVadis. So in that transition, what the biggest part was identifying those values, whether that was like time, growth, career progression, working with communities, different things like that. That was the first step. Now the second thing that I needed to do was coming from public health, I really doubted myself, saying, oh my gosh, like have I pigeonholed myself too long working in the public sector, because now it seems like it's a very specialized program. But it really made me draw back and reflect on the courses that I had taken in my master's and my undergrad. So as you know, working in the field of public health, there's so many different facets that we can get into. We can get into, epidemiology, like we talked about, health education, community health, public policy. We can get into health management, health administration, research, occupational health and safety, like environmental health. The list really goes on. So
Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
I would definitely say, looking at, the courses I had taken in my studies and, reflecting onto the different types of skill sets that I currently had on my resume and cover letter and things that I've already acquired throughout my working experience. So what I like to do personally is something called job matching. And, I would pick the top 5 companies, top 10 companies that, I think are very interesting to me. And then what I would do is have extensive research where I would say, okay, what are the different kinds of roles that come out of these companies, and what business units, more importantly, are they coming from? And this is really important because this is where the job matching and the job mapping actually comes from. Because taking your current role in public health, which some may feel is very defined, well, I shouldn't say defined, but is very specific in the field, going over to a new field such as tech is very foreign, and we might not see right off the bat that there is a lot of similarities, but in fact there really is. So for example, in my previous roles leading up to my onboarding manager role, I had done a lot of consulting, management level work, and I've done a lot of policy, and a lot of it was client facing too, so working with different partners across the table, different communities. And what I had done was I had taken those interests and things that I had done already in these roles and look for jobs within these companies that may have asked for this as a certain type of duty. So one of the biggest things that people could do if they're interested in going into tech is, I would say, looking at the different types of business units that are within selected companies. So, you'll have your core business units such as procurement, business foundations, you'll have HR, different things like that, and really doing that job mapping. So for myself, like I said, management and a lot of consulting roles, naturally gravitating to client facing roles in customer success and client success. So within this, type of business unit and this type of work, you'll find either like project managers, you'll find onboarding managers, customer success managers, account managers. So it's a blend between, client facing, project management, and also marketing and sales. So you do get quite a bit of an array of what can fall under there. But I would say that, that's how I tell, newly graduates and early career professionals, if they want to make the switch, or if they're looking into, trying something new, looking at commonalities between what you currently have on your resume and cover letter and skills that you've acquired to, different types of duties and qualifications in that of, a new position you want to enter to. So trying to find ways where you can translate that. So, either looking at, meeting targets, or how we articulate, you doing a specific task, and making that sound more appealing towards a recruiter within that type of sector. So one of the biggest learning curves for myself when I was applying was that I needed to understand the lingo, right? I needed to understand how we could translate public health deliverables into, private sector deliverables. So one of the biggest differences between the public sector and private sector is that, of course, one is fully funded, and the other one is driven for profit, right? So very different KPIs and goals and targets. So for example, working as a team lead for the Ministry of the Solicitor General, I was tasked with, collaborating with different types of health units, different health departments, and, community partners, and, reaching program goals. But if I were to translate that into a role in the private sector, it would look very different. It would be, what is what we call time to value? So how long does it take you to reach that certain goal? And what was the actual, amount of revenue, or the amount of, quantitative like number that actually created that success? So it's a different way of, translating and articulating and communicating your skill set, which was probably one of the biggest learning curves that I had to, learn to get through to achieve the successful goal of like transitioning into another role. So I think that's really what the process was like for me. Again, I'm no expert in terms of, what that looks like for other business units, but, in terms of personal experience, it was really identifying my values first, and then looking at what was the current job landscape. And then from there, really starting to map that out in terms of interested roles, and then looking at my skill sets and how I could, translate that into that role that I wanted to achieve. So that's kind of the process and where it took me.
Yeah, thank you for sharing that. I think that is very informative and very like action oriented, where people can look at a couple of businesses, look at the business unit, see what kind of jobs are coming out today, and matching that to the roles that they're doing. Because yes, I believe that like public health skill sets are transferable to so many different fields that are quote unquote outside public health. So yeah, I appreciate you sharing that, and that was definitely very, very helpful. And I hope that it helps other people as well, because it is more of a theme that I have been hearing about, like public health people using their skill sets and going over into tech and taking up like tech related jobs. So I just wanted to keep it out there as an option for many people, because too many people don't even think about it as an option, but it is an option for many of us. So just wanted to say that as well.
Yeah, that is a really great point, Amari. I think that, as a newly grad or early career professional, a lot of us gravitate to, what we call that quote unquote lowest hanging fruit, or what's the most glaring option in terms of, roles that you can get when you're done school. And a lot of people end up gravitating towards health departments, working at the state or the national level in terms of supporting like government or in the public sector. But what we forget about is that public health is vast and wide, and it's spread across so many different environments, different, lines of work. So I would definitely say that the private sector are one of those opportunities that really do bridge your education as well as that experience that people may be looking for, but they may be embedded into different names and roles, right? So a health promoter at a health department or health unit, may be that, but really a health promoter in the private sector could be under the name of like a health education coordinator, or it could be under like a program manager, or perhaps a consultant, or even a health education specialist. So there's just different names for doing the same type of work. But again, not always most glaring option, because, sometimes in school, or perhaps in my experience, it always seemed like the most glaring option was either going towards working at your local health department or working at a nonprofit organization. But knowing now that there's so many options because public health is so diverse, it can really take you across the board. So just know that there's so many different opportunities out there besides for, the lowest hanging fruit or what we naturally gravitate towards.
Absolutely. And I think like one other thing there is like the lingo, learning the lingo of the field that you're going in and knowing how to speak to it. And I think like to that point is you can connect with people in the field that are doing similar work to what you want to do, and like just talk with them and ask them like how to communicate this and like build those relationships that way, which I think is important as well. And I was going to ask you a question around like what can you do with a degree in public health? And I guess it's kind of like follows into like what we were just talking about. Like you don't only have to work at a national, state, local health department or a nonprofit, but these other tech jobs. Was there anything else that you wanted to add to that?
Yeah, it's kind of like what we talked about earlier. I think working in public health, because it is really such a broad, diverse of different types of studies, we can really go into so many different specializations or broadness in terms of where we go. So like I said, whether that's working in health promotion or community health, communications and marketing, public policy, research, occupational health and safety, or even epidemiology and research, there's so many endless possibilities. But just knowing where your interest lies, or perhaps what you like and what you don't like, is a good first stepping stone to say, okay, this is where I can take my interest in, look into other avenues where I think I might find success in. So it's very broad, but you don't have to limit yourself to just working in the public service sector. There's a private sector, and again, across all levels. We can even take it globally if we wanted to too, right? So possibilities are really endless.
Yeah, absolutely. And I think like just to add to that, like the current role that I work in as a program officer at the Health Foundation was not something that I knew existed or something that I could do with a public health degree. So just, like keep your eyes open and just keep your mind open to different opportunities, because I think a lot of new ones are going to start popping up as well.
Definitely. And that's a great point that you put, like a lot of new opportunities. And, I think especially with the pandemic, one of the things that it's really shed light on is the crux of the issues and the gaps that we already have within our current healthcare system. Right. So, really shedding light on, for example, partnership. So partnership development is huge. I remember when I was still in my undergrad, there was a new role that started emerging in the field, and this was really a community health broker. So, this was one of those newer, I don't want to say hybrid roles, but a newer emerging role in the field of public health, where we needed these individuals to work directly in the community to broker conversations about health with marginalized communities and underserved populations. And then, fast forwarding years later towards what we've seen in the pandemic, e-health is absolutely huge. That is another booming field of work in terms of public health and mixing private and public sector. So, the possibilities are really endless. Like, we still have some of the same issues that we've been trying to tackle for decades. There was an interesting podcast that I was listening to, and one of the people that were on there was someone that had worked within the national level for quite some years, as well as the local level, and then also as a surgeon on the side. And they had said something that resonated was, to work in public health is almost like a legacy. right? So, we've had the same issues within our healthcare system for decades, hundreds of years. But, you may not gravitate to seeing success, within your early stages, but, to go into the field of public health is to know that you'll be part of this legacy to help shape and change future generations to come. And as you can see, we have these new evolving roles that are coming down, and, that is almost being part of the legacy. So knowing that, with the innovation and, the changes within our environment and in our world, you can be part of that as you find your way in public health. It doesn't have to perhaps be within a health department or, that most glaring option, but in other ways in the sense that you can support, the broader support for public health programming.
Yeah, absolutely. I love that. And like in that same vein, I guess, what are some of the things that have changed in the job market that employers should be able to address as we see a new age cohort like enter the job market?
Yeah, that is a really great question. I feel like we can take this so many different ways, but to employers and hiring organizations, the one thing that I would say is definitely take a moment to review your current hiring plans. Just like we have for diversity, equity, and inclusion. Does your company have clearly addressed quotas for hiring newly graduates or early career professionals? And if so, do you have a well scoped out program to foster that recruitment, growth, and retention for these groups? I like to reflect and say, if you could put yourself in the shoes of these individuals again, there is lots of research out there that shows us that job shadowing has many benefits ranging, from professional development to skill development to reciprocal support, et cetera, et cetera, et cetera. Through this creates what we call sponsorship. And, sponsorship, unlike mentorship, is more about that action. So versus the former mentorship, which is more of like a soundboard and an opportunity to offer advice. A sponsor may be someone in a more senior position who will actually feel confident to put your name forward and broker an introduction to inner circles for you. So, taking mentorship, but with that additional level of action. Another thing that I would say is, for hiring managers, employers, and companies, we need to also think about our audience. So millennials, like according to Pew Research, is anyone born between 1981 to 1996. They make up the largest age cohort in the US. And I could say that probably closely similar to that in Canada too. While Gen Zs, anyone between 1997 and onward, are on track to actually be the most educated generation out there. So I ask companies, compared to other generations, millennials and Gen Zs are very value and driven and are very value and belief driven. So, research tells us that 40% of Gen Zs, have actually rejected a job or assignment because it did not align with their values. Me being one of these folks, I can definitely say, I've declined offers because it just simply didn't align with my values. These generations are more socially conscious, we're more environmentally conscious, anything to do with our governance goals and, our social and environmental goals, we are very in tune with that. And not to mention with these generations, retention, is only a few years, which is very interesting in comparison to other age generations and cohorts out there. So, I really, asked the question to talent acquisition specialists and recruitment specialists, when you're recruiting for hiring these groups, how are you enticing them to join your company? Hiring companies may need to rethink how they address their benefit and perks plans, for example, right? Because if someone's only in their role for a year to 2 years, and what is really that longevity of these long-term benefits that we're providing them, right? Instead, maybe we need to think about how we reconsider putting that dollar amount somewhere else, because salary increase or perks that are more appealing may be more beneficial towards these age cohorts if we're only seeing them within a role for 1 to 2 years versus, decades down the road. So many things to think about, especially as, we change in our environment, as we change in our role, the political landscape has changed, especially with, hearing with millennials versus Gen Zs versus the other age cohorts that are currently employed in the workforce. These are things that I would say have changed within the last few years and will continue to change and, affect the market later down the road, but many things to think about from these organizations' perspective as well.
Yeah, I think that's very important. And we do see that shift in like values being more important than certain things, and like just really thinking about how you incentivize this new workforce is something that is worth thinking about, and it's something that needs to change, because how it has been is not how it is going to be. And you should be on the front end of that change, I would hope, at least. And then speaking to more like early career professionals, what are some of the shortfalls or common areas graduates or early career professionals um, lack experience as they enter the workforce?
Yeah, that is a really good question. I think for early career professionals and newly grads, it's very challenging as is. They are already in a very precarious, ambiguous situation. It's that awkward gap from student to working professional, right? As they try to successfully launch with the least amount of hurdles coming down their way. So in school, we're so used to standardized testing, right, as a golden standard to receive feedback with their work. And many pros and cons of this, of course, but it's the easiest way to do a check and balance and understanding as it aligns with curriculum. We have the ability to benchmark, identify problems, and, areas of success and, opportunities for growth within students. So right off the bat, these folks have been trained to adapt their minds to providing feedback through testing. Now, I think this leads to one of the most largest gaps that we see out there is not being able to effectively set up success for feedback loops. So this, as a mark becomes that North Star that we attain to grab to. But let's be honest, if you're sitting in a performance review with your manager, what really does an 85.625% in biostatistics really mean to your program targets or goals, right? Rarely do we have opportunities to produce feedback through quantitative ways in school. So, which we know when coupled with, qualitative data is how we should be learning to address feedback in the working world. So I think that's one of the biggest, shortfalls or opportunities for growth that these early career professionals and newly grads have to offer. And again, a lot of institutional drivers to support this to better equip and prepare these people before they launch or even after they launch. Another thing that comes to mind is having limited opportunities to develop soft skills. So soft skills ranging from like our conflict management, ownership, effective communication, and accountability, just to name a few. We've got group projects, team sports, volunteering, and other work opportunities as great ways to develop these. However, a majority of students don't have the right circumstances to practice these effectively, which, may cause a lot of issues in terms of, that transition as they get into the workforce. And I know I mentioned this a little bit earlier, not so much a shortfall, but rather by circumstance, right? Of the ambiguity of just really learning how to quote unquote adult, right? So perhaps you may be moving back home, not seeing your friends every day, learning how to do your finances the first time, and not to mention having to get a job and continuously grow into your role. This really tests our physical, mental, social well-being, and everything else to the extremes. So in school, you have a core syllabus or a program calendar, so you know what to expect and what's coming down the road. But as you graduate or you're just starting out, it's not really clear where your next step in your future or your career path may be. So again, I think it's a little bit by circumstance and, by environment, but also there's a lot of other things that we can do, institutionally to support, a better, well-rounded individual when they launch post-graduation or even early into their career for sure.
Yeah, I appreciate a lot of those points, and I think it's very important, like especially in like this changing landscape of the workforce, to really think about all these points that you did mention. And then another question on like graduates and early career professionals: what advice would you share as like you continue to develop into the field or
Yeah.
within the field?
Yeah, yeah. One thing I tell a lot of newly grads and early career professionals is that, if an athlete can train for their sport, why can't we train for our careers? And, leverage what you've learned in school and in your first few roles as a stepping stone to build your career path. No experience is bad experience. There is always a connecting thread that you can use as a stepping stone towards your first, next, or pivoted path. Personally speaking, after a decade working in public service, I did a 180 into environmental tech. And from the outside looking in, these are two vastly different industries. However, there are many connecting threads. The Rio who wanted to be a phys ed teacher at 16 is definitely not the Rio we had when she had first accepted her first job. And that Rio is vastly different from the one that we have today. Change is scary and ambiguous, but change is also necessary because our values, our circumstances, and our environments change. Continue to make mistakes, but be a sponge and put yourself out there. Professionals in the field of public health are all benevolent. We share the same strand of DNA for wanting to help. So don't be afraid to reach out, and you might be surprised what the outcome may actually be. So continue to put yourself out there.
That was some poetry from Rio, guys. Definitely rewind and re-listen to that, because that was great. That was great. And if people, because I know you said you do support people who are early career professionals, where can they reach out to like get support around that? What's the easiest way for them to do that?
Yeah, absolutely. I would say the easiest way, to reach out if you feel comfortable is you can always, reach out to me on LinkedIn, what people say, slide into my DM. So you can always, connect with me and then send me a personal message, and, we can connect, and, we'll have a coffee chat. We can connect like we're doing right now. And, we can definitely find time to chat. You can also reach me at my personal email, which is rio.paloma.alegre@gmail.com. And I also have a TikTok account. So a little untraditional in the sense where, it's not your traditional networking platform in terms of how to reach out to folks. But, on my personal TikTok, you see a side of me perhaps that you don't see on LinkedIn. So, I post more job tips, how to optimize your LinkedIn, how to get out there, how to network for introverts, and, how to just adult. So, those are different ways that people can reach out to me, whatever your comfort is. I'm always here to make time to find, a coffee chat or, to share a few stories. But like I said, reach out. And I think people may be pleasantly surprised, whether that's myself, yourself, or any other allied health professional out there. So.
Yeah, we'll definitely connect with Rio, and I will be sure to follow you on TikTok after this. Try to get more active in the TikTok game sometime soon, but I appreciate you doing that work. It's important, especially for the next generation.
Definitely. Especially when we look at millennials and Gen Zs, a lot of them use TikTok as a source of Google. And, it's funny, a lot of, we do have to be careful in terms of like internet usage and, what we're referencing in terms of, misinformation, disinformation. But, I'm not opposed to using different types of social media as a way to spread the message because, again, it goes back to target audience segmentation and who we're trying to reach out there and how to make your voice effective in terms of ways that people understand your messaging. So I don't think social media is bad at all. I think it's a great platform to put your voice out there. But, as you said, TikTok is one of those booming ways for people to kind of like put their voice out there and to support the greater community for sure.
Yeah, absolutely. Agree with that. And yeah, there are pros and cons, but once you're using it and utilizing it for like your professional development, it's definitely a huge pro. And so Rio, what's next within your career?
Oh, that's a great question. I think about and I reflect back on my life and the experiences, and I think to myself, like, wow, Rio, I feel like you've really lived a full life. So, everywhere it's taken me from, my decade of working in public health, like whether that be at the local context, provincial context, or even, internationally and globally, I feel like, I've been very fulfilled vocationally. If I can continue working on like my vocational assets and where I want to go, my focus is to continue to be a steward for public health and our environment. So, finding ways and synergies to bring public health and environmental health together. Personally, I'd say I'd like to continue my passion for working with newly grads and early career professionals in a capacity to really break down those barriers and achieve their goals and build a network for support. Ultimately, I want to be able to bridge that awkward gap from student to working professional and, remind people that it's okay to authentically live for the moments that matter, enjoying your life at the same time while, working towards your goals. So I think that's my next step in terms of where I want to go and how I want to develop myself. And of course, just really being mindful of my own life and, how I want to live that. So remembering to be kind to yourself and to not bite off more than you can chew, and really embrace the moments that matter is really where I want to go next.
Love that. Love that. Look forward to seeing your stewardship and where that takes you.
Yeah.
Moving on to the Furious Five, the questions that I ask all guests. So number one, what advice would you give to a student trying to pursue a career in public health?
Yeah, kind of going back to what I said earlier, definitely that leaning in and don't be afraid to reach out, diversify yourself, and knowing that there's so many different ways that you can go in terms of working in public health. Like I said, you can work in anywhere from biostatistics to epidemiology to health promotion, and, not being afraid to reach out to folks that you either find, on LinkedIn, or whether that be in your own circles, and just, asking them for advice, and perhaps if there's any opportunities that you can support with. So definitely I would say that networking piece is very key, and it was to myself. And sometimes I understand that it's difficult, and especially for those people that may identify as introverts, just to even put yourself out there and just shoot out an email is a huge first step, and kudos to yourself, right? Rejection is very tough, and rejection is hard, but also knowing that it builds character and it builds grit and strength. So knowing that, you can continue, and then, you'll be pleasantly surprised at what you may find if you reach out to folks. So, yeah.
Great advice. And yeah, rejection is redirection. Some
Yeah,
people say.
definitely. Absolutely. Yeah.
So number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Yeah. So, my position is a little unique as I transitioned from public health to environmental tech. But if you are in that, whether that's, an early career professional or even a newly grad that has said to yourself, okay, I've taken a degree in public health or applied health in general, and I want to get into something very different. Like, what would I do? I would say, go back to that value setting. Value setting is absolutely huge, and it's very invaluable because it helps to set that redirection as to where you go next. So, for myself, going back, it was really, okay, I wanted somewhere that I can spend my time and commitments to focusing back on things that I loved, which was, learning more about the environment and, having that work-life balance, but also having flexibility. And those are my values when I was looking at this role. For newly grads or early career professionals, maybe you want to have more vocational growth or career growth and development. So, finding a role where you can, grow into that is definitely starting off with your values, and then doing that job mapping, and then that job planning, like I had said, right? So looking at selected companies or organizations or business units that have roles that you're interested in, and matching that to your skill set. So that's what I would definitely recommend, and tell someone that wants to kind of be in a position that I'm in right now.
Great advice. And number three, what's something you're working on improving in your life right now?
Yeah, another great question. I think for myself, it's trying not to bite more than I can chew. So, really at the end of the day, what I want to be is more mindful of what I'm focusing on. I remember when I was in, school, my undergrad and my bachelor's, it, like many people, it was very go, 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 go. And it was like, okay, what's the next thing? I got to cross this off my list. Where do I go from here? Like, I've been there, done that. So where do I take this? But, what I look back on is I wish I had been more mindful of, even that process, just being more observant and being more in tune with, what was going on rather than what was being, portrayed in the next few days or the next step. Like, I wish I had just, concentrated my efforts towards being more absorbed within what I was experiencing at that time. So I think that's something that I am currently trying to work on, taking time to enjoy the moments that matter, and, really authentically living my life while still having to work towards my career. I think that's really what's important to myself.
Yeah, I love that. And I think we don't focus enough on that, or sometimes it takes us too long to focus on that. So I appreciate you sharing that.
Yeah.
Number four, professionally, do you recommend anything?
Definitely. So, reflecting back on my life and, the different books and different types of podcasts and different series that I have personally read that have really shaped me, 3 books off off the top of my head that really have shaped my life is one, Atomic Habits by James Clear. So I don't know if this is something that you've seen. I know it's a very popular book. I think right now it's currently, on the top 10 of, New York Times best-selling business books. But Atomic Habits is great because James Clear really breaks it down in terms of how little habits or these atomic habits can turn into life-changing habits. So this is something that anyone, regardless of, your role, position, or where you are in life, can take back and, bring it into your daily life. The second book that I would highly recommend, and this book has truly shaped me in terms of like my personal growth, my vocational growth, especially within the last year and a half, is How Women Rise by Sally Helgenson and Marshall Goldsmith. This book, totally has changed the way in terms of behavior and perception of how I view, the workforce, my personal life. And it really goes back to that change management piece. So, I was saying, the 16-year-old Rio that wanted to be a gym teacher, phys ed teacher is so different from the Rio that, we have speaking on the podcast today. Knowing that, as your environment changes, so do your actions change and so do your values. So How Women Rise really, portrays all of the different types of steps that you can take in terms of your job growth and, that vocational growth as well as your personal growth. So definitely recommend, not just for women out there, but really for everyone as a good read. And the final book that I will say that really shaped my life was I Will Teach You How to Be Rich by Ramith Sethi. This book, absolutely, for people that are perhaps more of their newly graduates or early career professionals, this book really taught me how to set myself up for success, like the basics 101. So everything from financing to adulting to, priority setting, where does that really take you? And it gives you a high level overview with tangible and actionable steps on how you can make moves towards being, more financial literate, post-graduation, even into your early career. So 3 books that have definitely shaped me holistically to be the person I am today. And besides that, just reaching out to other folks too. So like recommending, like I said, that networking is very key. Again, I know there's many awkward steps towards networking, but like I said, the first step is just really, sometimes reaching out and, extending that olive branch to say, hey, like, I just want someone to talk to because you would be more surprised than you think at the end of the day. But yeah, these are definitely things that have shaped me in terms of, my knowledge and where I am in terms of reflecting. So yeah.
Yeah, awesome. Well, thank you for sharing those. I've read 2 of those, Atomic
Awesome.
Habits and I'll Teach You to Be Rich, which I think are great recommendations and definitely very helpful. Especially like I Will Teach You to Be Rich because like the perspective on how he shifts like money and putting your values aligned with
Oh,
money, I think is a lot different from a lot of the other perspectives you hear on the internet. So like if someone is interested in like knowing more about personal finance and how to live that rich life that you would like, definitely recommend that book. And I'll put a link in the description as well
yeah.
as on the show notes for sure.
Yeah, yeah. Ramith Sethi is great. And, one of the things that really stuck out to me was his personal story where he said, how do you define your rich life? And, for him growing up as, a child of 2 immigrant parents, he said, my rich life is just being able to even order an appetizer when I go out for dinner. And that was something that was so foreign to him and his family that he never really had done growing up. And it can be as simple as that, right? Or it could be as, large as saying, I want to be able to live a comfortable life and support my family and for my kids and everything else under the sun. But it really puts it into a perspective that's an easy read and it provides actionable and tangible steps that you can even do today to say, how can I be more financial literate? So great book.
Yeah, absolutely. And I like that as well because he like makes you write down and think about these things that we only think about in like a broad
Yeah,
scheme. He makes it very specific to like, okay, what does this look like for you? Which is I think is awesome. And yeah, I think I read it in like 2 or 3 days. So
yeah.
definitely definitely an easy read.
This is such a good read. I cannot put this down. It's amazing, amazing. Yeah.
Yeah. Awesome. But last but not least, where can people connect with you, Rio?
Yeah, so like I said, LinkedIn is a big one. TikTok is all the craze right now in terms of, whether that be just for funny videos or for self growth or for, planning your business. Like I said, it's another way that you can reach out to me that might not be as formal as LinkedIn. I do post, job tips, how to optimize your LinkedIn, networking and how to support your overall well being and growth and really just adulting. So that's some stuff that I put on there. And then, of course, my personal email, which is rio.paloma.alegre@gmail.com.
Awesome. And what is your TikTok handle?
So it's RA_Paloma. So
Okay.
you can find me there.
Awesome. And I'll put that in the description and show notes so also people can connect with you there as well. But thank you so much, Rio, for coming on and sharing your insights and sharing your journey and changing from public health into environmental tech and sharing insights on like how to do that or how to think about that if that is something that someone is interested in their journey. So thank you so much.
Yeah, no, this is great. And like I said, don't hesitate to reach out. And if there's any follow-up questions, happy to take it offline. But this was absolutely great. And thank you so much for having me as a guest.
My pleasure. My pleasure. Housekeeping items, everyone. Thank you so much for watching. Be sure to subscribe if you have not subscribed as yet, and leave a 5-star review and share it with a friend. Really helps the show get out to more people. I appreciate you all. Peace.